after lunch, day one. Today's session is Local Solutions for Global Impact, Strengthening Menstrual Health Through Decentralized Access Models. And the session is co-hosted by UNICEF. My name is MHAi. I'm a WASH specialist with UNICEF, looking at menstrual health and WASH in schools. And we also have our partners here in the room, WaterAid, Days for Girls, IDE, and online our friends from Menstrual Health Action for Impact. We're based in India, and thank you for being with us in the middle of the night. Really happy to be here. And I wanted to share that last year at UNC, there was a bus ride that made a big impact for me. I was actually on the bus, sitting next to someone, randomly talking about local production of reusable menstrual pads, and and how we're all investing in this, but we don't really know if it works. How can we make these models more successful? Can we learn from them, and we can share these learnings? And so 1 year later, here I am presenting a study that we did on these models, and also sharing some examples from Sub-Saharan Africa today. So I'm really excited actually, because this idea started a year back on the bus, and here we are sharing some of the learnings that we have so far. Okay, there is a clicker. So what are we going to talk about today? This is our session agenda. So we'll have the welcome by myself, MHAi. Then we have a quick Menti. Jess is going to lead that. Then we'll have 3 presentations. So first the study that I referred to. Then we have the learnings from decentralized access models in Sub-Saharan Africa from Days for Girls, and learnings from market building in low and middle income countries for sanitation, and emerging insights on menstrual product markets in Ghana and Ethiopia from IDE. And then there's some time for questions. Then we'll have a group work, and Diana is going to lead the group work, share back, and a Menti to wrap things up. So that's our session for today. So what are we going to talk about? What are our session objectives? So first, I think we're going to present a comprehensive framework and a conceptualization of what are decentralized access models for menstrual products. And it's a big mouthful, and I'm very curious to know if you actually know what decentralized access models are. What does it mean? So we're going to talk more about this. Then we're going to describe and discuss the potential of these models in enabling community-led sustained access to affordable quality menstrual products of choice. And lastly, we want to get out of this room with some actionable recommendations to guide programming practitioners and policymakers who are considering investing in such models. So these are our session objectives, and again, welcome, and really look forward to having the conversation with you today. I'm going to hand it over to Jess for our Menti.
Thanks everyone. My name is Jess Straight. I'm the Global Advocacy Manager with Days for Girls International. I'll be helping on the tech side a little bit, so hello to our virtual audience. We'll be supporting you throughout and supporting with some of the IT things in the room to make everything run. If you've not used a Menti before, it's a little interactive tool online that we can use to kind of get a sense of what's going on in the room. It's like an icebreaker without having to call on people, which is really nice. So if you can scan the QR code on the screen, or if that doesn't work for you, you can also go to menti.com on your laptop or phone and put in the code 59203818. I still see some scanning. Okay, the code should still be on the screen when I switch here to the Menti itself. Oh, look at that. Okay. So let's get into our presentation mode. Great free tool for anyone interested in using this kind of thing for a presentation. It's really nice. There we go. Okay, so let's jump to our first question for the group. Have you been involved in decentralized access models for menstrual materials in one way or another? You should be able to vote on your device screen, and we can see the results in real time as everyone participates. Okay, I see 2 more people have joined that haven't voted, but one of them is probably me on my laptop, and the other one might be this laptop. So I'm going to say this is about everybody. So we have a good mix of folks, not everyone coming from the same background, which make this for a fun session. Okay, pulse check of the room. Do you believe decentralized access models can be successful? Maybe just 5 more seconds here. Okay, so we have our work kind of cut out for us here as far as definitions. And I think we have one more intro question. Okay, this is an open-ended, no right or wrong answer. This is, again, a temperature check of the room. But what factors or enablers do you feel could set up a decentralized access model to be successful? All right, I see some themes here, some policy focuses with government, talking about capital and supply chain, other elements of running a business. Okay, that is it for our intro questions, just to kind of get the gears turning, the thoughts flowing, and I am going to switch back, I hope, to the correct presentation. Look at that. Okay, thank you all very much for participating.
Thanks. We're still in slide. Okay. Yeah. So thank you so much for the Menti. And to be honest, one of the things I was nervous about today was the IT part of things. So I'm really happy we have Jess in the room. It makes a big difference. Yeah. So decentralized. Okay. This is interesting. Okay. Jess, would you mind one more IT question? Are you able to get the slides up here as well? Yeah, that's okay. Great. Yes. Okay. Great. So here I am, being all nervous. Okay. Yeah. So interesting. We did this Menti because we thought maybe not everyone knows what are decentralized access models. Because when I first read that word, or these words, I wasn't sure either. So we're going a little bit more into detail today. So I'm going to present a study that we did together with WaterAid, and that was conducted by Menstrual Health Action for Impact on decentralized models for menstrual product access and bridging the last mile gap in low and middle income countries. Now, why, first of all, why does menstrual health matter? So we want to take a step back and say, what are the important parts of menstrual health? What are the important aspects? 1.72 billion girls, women, and others who menstruate are in low and middle income countries. So it is a significant part of the population that we are looking at here, and menstrual health is significant for their health, well-being, and rights. And we need to look at it in a holistic way. So it means accurate and comprehensive information. I already saw education there on the word cloud, but also access to a choice of affordable and quality products, adequate wash and waste facilities, supportive health systems and services, and also breaking stigmas and taboos. And today the session focuses mostly on the access to a choice of affordable quality products. But we're not excluding the other components from our lens of how we look at things today. Why are we focusing on products? It's because there is a huge unmet need for menstrual products and LMICs. So 613 million people who menstruate in LMICs still are in need of menstrual products of their choice that are affordable, quality, sufficient, etc. So these are the latest figures. And why are they not able to access? It's it's a multiple reasons. It's not just one reason. There's many. So, for example, commercial markets don't reach the most vulnerable groups. Free distribution, which often is considered a solution, it's limited, it's unsustainable in the long run. Supply chains may not work, they may be fragmented, or product choice is limited. Maybe people have access to products, but it's not the product of their choice. And then, of course, there are last mile delivery hurdles. So, therefore, we feel that decentralized access models can bridge this unmet need. What are these models? So, these models locate key aspects of the product value chain in or near the community, redistributing the decision-making power and the resources to community-based or community-led groups or institutions. So it's really bringing, for example, production to the community level, decision-making power to the community level. And this is a complementary mechanism within other market or broader market-based approaches, and it fills a critical access gap. So these models we have seen a lot in the work that we do as UNICEF, as others, and we always felt, why does the normal market, why does the commercial market not work? Why are people not able to access? And then when we invest in these local or these decentralized access models, are they really the solution, and are we doing it in the right way? Are we really meeting the unmet need? And we were not sure if we were doing it right. And that's why we asked, can we do a study to look at all these different models that are currently out there, talk to the people who have been doing this for a long time, learn from them, and come up with a set of recommendations to ensure that these type of models actually meet the unmet need, so to say. So this is how the study came about, and I'm happy to share some of the findings with you today. So we looked at 3 archetypes of decentralized models. So archetype A, B, and C are here on the screen. Archetype A is looking specifically at single-use pad manufacturing, B at reusable pad manufacturing, and C at community-led sales and distribution. So A and B are somehow similar because the locus of the decentralization is in the operations. If you look at the value chain, you look at R&D, inputs, operation, outbound logistics, and the marketing and sales. So the locus of decentralization is in the operations for A and B. It's just that the type of product that is being produced is different. Archetype C is slightly different, where the locus of decentralization is more on the outbound logistics and the marketing and the sales. So it's not necessarily production of the pads, but more buying them from vendors and then distributing and sales at the community level. So how do these models look like if we look into more detail? Like I already said, the focus of localization is slightly different. So for A and B, it's more on the actual manufacturing or the production, whereas for C, the sales, it's more on sales, marketing, and distribution. Product types are also slightly different. So for A, it's on single-use pads, and often it's only one design or one size because you need to invest in machines and a setup, and therefore you could only produce one specific pad. For textile-based, it could be different ways. It could be period underwear, reusable pads, or a variety of products that could be produced. And for archetype C, it could be a basket of products depending on what the community sales agents decide to sell. Then, of course, there are the supporting activities that are all part of the value chain that are important. And then looking at the cost, there's different levels of upfront costs that are needed to be invested for this model to be effective. And the highest cost that you see here is for the single-use pads, and can go up to $60,000 to set up the machinery, the inventory, etc. Archetype B is much cheaper. It's only around $800 to $1,200, and then archetype C is very flexible. You procure materials, distribute it to the sales agents, and invest in the marketing, but the cost is slightly, it's much less than the other two models. And then capacity is also very different. Again, C is very flexible. B, we've seen factories or production units that can go up to 6,000 pads, and for the reusable production models, they can go up to 10,000 pads per day. Okay, so like I said before, when we looked at the decentralized models, we looked beyond just the product only, because there are other reasons for decentralization of access, for us to invest in these things. So one is obviously access to the product itself, and ideally sustained access, products that are affordable and have good quality, but there's also decent jobs for community members. So it's often considered a livelihood project. It's around destigmatization of menstrual products, awareness on menstrual health, and then community ownership. So, and I apologize in advance for the small letters. If you're sitting all the way in the back, you're not able to read, feel free to come and sit here in the front. You can also read this in much more detail in the brief that hopefully will be published in the next couple of weeks. It's almost ready, it's with the designer. But just in short, so some of these archetypes are able to meet these different objectives if they are designed in the right way, and some are not. So there's definitely issues with the cost. Some costs are really high. A lot of the models are depending on grants and not able to look at blended financing options. Decent jobs, there are issues there as well. For example, single-use pads, only maybe 5 to 10 people could be employed. For reusable pads, 10 to 50. So there are definitely issues in terms of, are we meeting all these different outcomes? And therefore, the role of intermediaries are really important, and we'll be hearing from 2 intermediaries in the next 2 presentations. So I'll let them go more into detail, but just to say that they have a critical role to play to make these decentralized models a success. And this goes for a whole range, around the whole value chain. Research and development, sourcing, distribution, advocacy, financing. They can help with quality assurance. They can help with bulk procurement of materials. They can help with quality control, taxation issues. So these intermediary organizations really have a role to play, and we'll focus more on that in the group work and in the next 2 presentations. So in summary, decentralized models can fill a last mile gap. When they're complemented with commercial supply chains, they can meet the need of unserved populations. They can generate livelihood, but not as the primary income generator. They can build community ownership, but only if there is additional investment in advocacy. They can spread awareness, but again, it requires additional effort and investment. They cannot replace commercial markets. They're not a one-size-fits-all solution. They're not always financially self-sustaining without donor support. I think it's really important to mention this, because this is a big question that we've had. And they cannot always be commercially competitive, because there's high costs, limited economies of scale and scope, inconsistency in quality, and there's high cost of marketing. So we really have to look at decentralized models for what they can and cannot deliver, and then invest them in these models with that in mind. So I know I'm at time. This is my last slide. I just wanted to flag that this is an important slide, because the group work is also going to focus on this. So I really want you to pay attention to the slide. These are some recommendations to strengthen such decentralized models. There's many here on the screen. Intermediaries often have, like I said, a key role in this. First one, you have to match the model to the context. You need to understand the markets. You need to understand what you want to do, what infrastructure is possible, what is not. We also have to look at how can we ensure quality, because if the pad is not the right quality, it could be a health hazard, or women would just not buy it. Financing is really important. We cannot just only rely on grants. It has to be combined with loans. capacity building is really crucial. I think I saw it on the screen already in the Menti. We have to focus on manufacturing, but also on sales, also on marketing, and also on advocacy, education, and awareness. So we have to look at a broader range of capacity building. Integration with other ongoing menstrual health programs is a key. So using opportunities to bring in these models in menstrual education in schools, or health workers to talk about menstrual health. So there's many ways to link these models to other ongoing programs. Supporting intermediaries, they have a role to play and they need funding to be able to do that. We need to foster the enabling environment and the ecosystem, so standards, taxation, reforms, procurement policies, make it easier for bulk procurements, and then we need to track results, what works, what doesn't. Okay, I'll leave the quote here on the on the slide for you to read, but I just wanted to say thank you so much. I did not do the research, so the colleagues that actually conducted this research are online. They couldn't be here in the room. So if you have questions, try and answer them, but otherwise we can also get Arundhati and Tanya to respond to them later, and they are here online and in the chat. So I just wanted to say thank you so much, and we have time, maybe 2 minutes for questions and answers if you have. Thank you. And otherwise, otherwise we have saved time and then we go straight to the next 2 presentations, which I don't mind. Yeah, let's do that. All right, so I'll hand it over to Diana from Days for Girls.
You could do, I do.
Well, first, welcome everyone who's joining us online, and a shout out to Arundhati and Tanya for that great research, and you did a great job presenting. And thank you for being here. We're super excited to share with you. I represent Days for Girls International. We try to tackle and answer the problem of menstrual health by doing menstrual health education, decentralized access models, and advocacy. And I'm here to tell you that we are learning forward. Days for Girls started in 2008, and we were distributing and making menstrual products, and our first opportunity to do this model was in Uganda, when a Ugandan citizen came and said, wait, why can't we be empowered to do this? What are you doing? And we're like, of course. And so that's when we started, and I wanted to tell you, we are still learning. We are getting closer at this, but there's lots of things. It's not a super easy model, and there's not a one-size-fits-all. So I wanted to jump in and tell kind of where we're at, and then lessons that we've learned from our years of doing this since 2012. So right now we have 58 small-scale enterprises. That should be, I wanted to say 41 are based in sub-Saharan Africa. So the focus of ours are in Africa. And between these, they employ 265 people, 219 women, and 46 men. So you can see this, exactly what the research showed. This is not their primary income. All of them are doing this as secondary income that folds into economies of scope. One of the biggest ones being they make soap as well. And then we recognize that we are reaching the last mile. Our enterprises are positioned to really work in areas where very few organizations go because of the hazards of the roads, because of rebel activities that are happening. And they do work in like some larger cities, but our scope is really that last mile reach and creating awareness. We feel like there is a part to play in the market to show all kinds of products are available. And so we're hoping to seed that market then that can help bring more access to things. So we also, you'll hear me using decentralized access models with the term social enterprises, but I wanted to talk about what do they do. So as Mariah touched on in the research, they don't just manufacture. A major component of ours is also advocacy work and menstrual health education. And then advocating for policies so that we can get programming and see systemic change in those communities. Again, focused on the last mile. Their operation model, what we found is when for our small scale, when they can make at least 2,000 kits a year, that seems to break even for their fixed costs. And anything above that, then they can pocket that. And then we provide a lot of resources that I'll go into as the aggregator as well in a minute. And then their sales strategy is they are right now limited direct consumer sales. That's just been a really hard thing for many of them to do, but they do facilitate orders through a lot of bilaterals, multilaterals, INGOs, and governments. Many of ours have worked with their local governments, have learned the policies, like in Kenya and Nakuru County, where there is actual funding to help support education and emergency pads. They've tapped into that by teaching their local leaders, this is what the policy says, and here's how we could be implementing it. So we can't underestimate the power that they have in their communities. Just so you're aware, I just wanted to throw this up quickly so you can kind of see in USD the price of our pads, and they're a little bit different. Ours can be lined, they have a carry pouch that's waterproof, so when whoever's using it can change it at work or at school, but that's basically what they're producing. One of the things as an aggregator that we do in our branding is you can see this says Days for Girls on it. It's branded fabric because they are a part of a bigger community, and we're hoping it's like KFC. Wherever you go, you know that chicken, you're gonna get that same Kentucky Fried Chicken. When you get a Days for Girls branded thing, you know that it's quality, and we'll get into how that happens. So what is our role as the aggregator, the advantage we bring? You know, I think this is one of our biggest lessons learned. When we started out, we only offered support and training, just very light touch. So now we've realized, no, we actually can do so much more for them. The first one being materials. I want to give the example in Malawi, one of the fabrics that they use is flannel. Flannel, if it's there, it's always inconsistent, and if it's there, it's poor quality usually, and it's $10 per meter. So what we've been able to do is buy in bulk for all of our enterprises, and then we can cut down the cost of that, so they can get it into, we can get it into Malawi between $2.50 to $5 per meter, and that's their fixed cost. So they can then have that, you know, as their fixed cost, then they can work on other things. So we've been able to do that with lots of things for them on their materials side. For the patterns, one of the things that we've loved working with them is they know the needs of their community. So for example, in Nepal, one of the things they noticed in Nepal, the users wanted it longer. They did not want our standard pad, so then we created an extra pattern on how it could be longer. So we really listened to the feedback that they have, but then we have the resources that we can really work on the R&D and get it better and send them back the tools. So I would say our pattern is the 30th iteration that we've had because of the feedback of our local leaders. Branding is very important. Not only do we provide the patterns, but we also provide the resources for the menstrual health education, and they're really building a market identity of Days for Girls, but they're still their own. They recognize the product comes from Days for Girls, but they are their own model. And then one thing that came about, again, because of listening to their needs, is the foreign exchange restrictions. Many of our enterprises, there are restrictions on the banks at when they can take their money out, if they take their money out, what is the process? And so they came to us and said, could you help us as we're getting grants and donors are buying things? We're losing so much money. And so we created a way where they could earmark it through Days for Girls International, so we could use that money then to funnel over to pay for their fabric. So they were getting 100% of the finances going to them, and it wasn't being backlogged by banks that were like being shut down by rebels or bureaucracy. One of the biggest challenges that we have is quality. Especially, we really, Days for Girls International, we support standards. We are on the ISO TC338, that's the menstrual product standard that is ISO is being built right now. And so we really feel like in the beginning, we would see the quality, and it was all over the place. And we're like, that's not good for the brand or for more importantly, safety. And so we thought, how do we tackle this? So I was just going to share a couple of things that we've done. Is we've created all kinds of templates that literally they can lay directly on top of their products. And we now have categories. Is it a gold standard? Is it a fit for purpose? Or is it not fit for purpose? And they can know this by how it lays. Like a gold around some of these things, that shows it's like gold, perfect. And then we have this one little card right here. They can actually measure how wide are our pockets. Is it the right level? And then we do site visits. We have hired one of our specialists goes to every enterprise for two things. One is to show them these are products you can use in your market that are safe, that are viable, and they're reliable. And then they constantly work on their quality control. They send in pictures. So we've really, I would say, we're to the point where if they're gold standard or fit for purpose, we will refer them to other people, and they've built quite a reputation on quality. And why that's important is then we know that whatever country they're in, they can pass a standard when it is published. Kenya, South Africa, Uganda's, they'll pass because we built that quality to meet the standard that is coming, that's been published and coming. So what else do we do? So what we've done is we're leaning into the following areas. We've providing monitoring and evaluation. Every month they have to do an impact report, and what we found is those who are doing their monthly impact report are usually the ones most producing. High quality, they're into advocacy work. We also give them tools to go out and ask questions, the pre and post test, and do some focus group discussions. I'm trying to go fast. Also, we're working on a lot of them, like in Johannesburg and in Nairobi. They really want to get to, okay, I gotta go faster. Sorry, there's so much to share. But they really want to get to customers, and so we're working on that. So you can read. Oh, I don't want to underestimate the power of advocacy. Very quickly, in Malawi, one of our local enterprise leaders, because they are best positioned to be in the country, they have that relationship. So she was able to work with the First Lady, and the First Lady was trying to decide in her first term, her husband's first term, do I take on menstrual health? She said, could you come in from international to support me? Just so that they could see this is so much bigger than just Malawi. And that has happened and helped pass policies, and that First Lady came on board that first year because we could come in to reinforce, but that opportunity would have never happened without that local leader. Really quickly, lessons we've learned from struggling enterprises. We've had many who have come. One, they've been told, you should do this. This is a great thing for you. And then the other one is they've been given too much support. Well-intended people give them this, give them that. They have to have some skin in the game. There has to be a little bit from them that they put in to see them fly. Skills gap. They can be passionate about menstrual health, but they still need some business expertise. And then the barriers are they use poor quality material. But things I want to show you of those that are thriving is they were organized. You could go to them and they have a business plan, they have their marketing plan, they're tracking their revenue, their supply chain. They have a secondary income, they're folding into and leaning into their economy of scope, and then their production. This was very interesting. You could do 2,000 a year, but what's important is, are you sewing every month? The sewing every month, the consistency is what makes the quality high. So you don't want stop and go sewing, you want it the whole time. And then they're very proactive. They are leaning into making opportunities happen. Someone in Zimbabwe really wanted to meet with people, so she gets on Facebook and she finds where they're going, and she just shows up at the events and she starts talking to them. And one, they were looking for a climate award, and she goes, I didn't technically fit, but I threw my name in so I could get before the people. And that brought all kinds of opportunities from other multilaterals. So basically, in closing, these decentralized access models absolutely have a role to play. We have seen time and time again how, because they are embedded in the community, they understand the culture, they understand the needs, they have the relationships with the local governments. And so we want to empower them. They will play a role that no one else can, and they fill that gap in the need. So just to close, one example was in the Democratic Republic of Congo. Right now the rebels are there, and that enterprise has partnered with Swiss Aid, and they're going to places no one could be going because they're there and they know when to move and when not to move. And those are 3,700 women and girls that are being reached. So thank you so much for your time. I will take questions after, but there absolutely is a need for this. It's hard, but it's worth the struggle because they are working their hearts out on the ground to provide menstrual health to all. Thanks.
everyone. My name's Elise Mann. I'm here representing WASH at IDE. I'm also here. You're stuck with me instead of my colleagues Martha and Hilda from Ethiopia and Ghana, respectively. And I'm going to talk to you about a lot of what we've already heard so far. If you are less familiar with IDE, we've been around about 45 years. We work in 12 places around the world, always working with entrepreneurs and businesses to help unlock local solutions to challenges in ag, WASH, menstrual health, climate change, so forth. Last year, we announced a new strategy really focusing on women's entrepreneurship specifically. So we've always worked with entrepreneurs, and now we also will work with women entrepreneurs specifically, and really want to make sure that we're addressing the needs for those entrepreneurs we're working with, as well as seeing menstruation as a space for those entrepreneurs to work in. Oops, wow, really got crazy. Okay, so we have been building markets for sanitation for the last 15 years. We have facilitated the sale for 2.2 million toilets around the globe. And when we started getting into menstrual health markets a couple of years ago, we wanted to think about what were the lessons that were relevant for this work based on what we'd done so far. So quality of the product is essential. We just heard a lot about that. We've seen that across all kinds of different experiences of sanitation as well. One of the main reasons why CLTS hasn't worked on its own. Thinking about a bright blue toilet that people are a little bit more willing to pay for because of the product itself and the quality of it is something we've seen in Ghana. We have experiences in Bangladesh where people are investing more in porcelain instead of sato because sometimes that might be worth it for them. So quality of product, essential. People are willing to pay for products if they value the service provided, but requires a mindset shift. So we have done some work with solid waste management services in Cambodia. And when we first started doing that, everybody told us nobody was going to pay for a service around solid waste management. And just in the testing, people started signing up. So we've seen that again and again be relevant here in this work too. And then work should be done on demand and supply at the same time. There have been so many different experiences in our work across the globe in sanitation where we've started to build demand, but then you can't deliver that demand because the supply chain linkages haven't been addressed so that the demand can actually be met, and then people start canceling their orders, or vice versa. You get a lot of artisans and a lot of businesses excited about this new skill, this new diversification, and then there's nobody to sell the product to. So with those lessons, I'm going to speed through 2 case studies from emerging work we have. Very similar to Diana, we are learning forward, and this is very early work for us. So Ethiopia is our geography for IDE's programming, where we have been doing menstrual health work the longest. We did a bunch of human-centered design work about 5 years ago to start understanding user preferences, needs, experiences, and this has really led to a women-led distribution model. So of the examples from the study, this is the archetype C, so community-led sales and distribution. We are thinking about how to get all of these different products that are made in Addis, in Bahadar, and distributed. Right now, we're mostly working for Mela for her, and are in exploratory stages with the day pads, as well as some other products. And here we've got an MH sales agent, so we are working with sales agents to do direct sales with community members, who says, in my community, there's a significant demand for menstrual pads, and I'm delighted to be involved in this business. Oh. And then my second case study that I'll speed through these lessons with is in Ghana. We are not as far along in this work, but we have done a lot of human-centered design, building on an existing pretty broad WASH program in the north to understand what type of needs menstruators have. So there was a bunch of research done in the second half of last year around market analysis as well as user interest, practices, barriers, and found a lot around affordability, education, just a lack of awareness of the different types of products available, and that distribution was a challenge again and again. We are in the middle right now of testing some of the MH product bundling with sales agents that are already selling sanitation products. So, quality of the product. When we first started this work in Ethiopia, we did a small-scale pilot with local seamstresses and tailors, and it went terribly. I think we sold 13 pads in a longer time frame I cared to have recorded. I think local seamstresses and tailors were really excited about those locally produced products, but the quality was a huge issue given all of the different importation issues. And again, people could tell the difference between the products they started using from Bahadar, from Addis, compared to these locally made. So we didn't keep doing that pilot. From HCD research, and don't worry, I won't read all these words and I won't make you read all of these words, but all of this is to say, we know quality of product is essential, but also product quality also means a diversity of high quality products, right? Different people have different preferences, and we heard that in all of our HCD work with our Ghanaian colleagues. And I think it's really helpful to understand what do people start using and when and why, and how does that inform their behavior. Same thing for me, both from this jumpsuit to my menstrual products. Lesson 2, people will pay for products if they value the service provided, but it requires a mindset shift. Martha asked me to say this one first, and we had to negotiate, this one being the second one in the slides. In Ethiopia, after our not so successful local pilot with local seamstresses, we did a week-long training with sales agents. It was with GIZ to have sales agents learn about the different types of menstrual products. And again, through both this training, there were 52 sales agents were trained. There were 50 products immediately given. They were all sold out by the end of the month, compared to that much lower, I think 13 sales. And I also wanted, this is not our work, but this is Noble Cup, also based in Addis. And I think this is a really interesting example of a newer product, but they have to build in an extra 2 to 3 hours of workshops with community members to start to change. Ooh, wow, 2 minutes, okay. This is one thing from Ghana. When my colleagues were doing this initial testing, when they were trying to get people thinking about when they would use different products and when they'd be willing to pay for it, it was a lot more effective to tie it to their menstrual journey. And different people had different willingness to engage with those menstrual products with thinking about the journey. And then last thing, work should be done on demand and supply at the same time. Again, won't make you read all of these, but really wanting to think, we know knowledge, it's really hard to demand something that you don't even know exists. And we've seen that again and again across all of the 5 geographies where we have done some emerging MH work. So got a lot of different misconceptions and a lot of educational awareness. So there's a lot of potential here for education through demand, but we gotta get there first. We've already heard about supply chain challenges. We can't deliver any of these products as we think about local distribution with such huge supply chain gaps. And then we have heard a lot and are thinking a lot about market distortion. To what degree does the existence of free distribution undermine somebody's willingness to pay for this, and how do you design that in a way that makes sense? I'm gonna speed through this one. And then just lastly, I know I said I'd only do 3 lessons, but with all of the different discussions today around enabling environment, obviously markets don't work without a strong enabling environment. So demand, supply, a little bit irrelevant if we're not also talking about the enabling environment. So in Ghana, there's a lot of active discussion right now around standardization and certification, especially around reusable pads. And I know there are lots of different social enterprises that are withdrawing from Ghana because of that. And what it means to viably operate there. And I think that piece is one that we have a lot of work to do to keep thinking about what is our value add as an organization, where we're thinking about MH markets and strengthening those MH markets, knowing that it's really hard for innovators and social enterprises to access the space from a financing perspective, given all of the expenses up front, when also people can't afford menstrual products and the tensions there. And then we want to make sure that in our work, we're addressing all of the different social and cultural and economic taboos that change our willingness to talk about this topic. Whew, sorry. Thank you so much. Oh, questions? Questions for Diana and I?
You can tell Elise and I could talk about this a lot more. It's just, there's so much. Okay, so now what we want to do is we really want to hear from you. And so if you could just take a second for individual reflection. You know, we start out, well, that's at the end.
No, we don't do it. Skip.
Okay, we're gonna skip that. We're gonna move into our group work. I'm gonna set this up if that's okay. You can see around the room, we have 4 different notepads that we would love to hear from you. And the overarching question is, how can organizations support success of decentralized access models? So what can organizations do? How can we support them? Through strengthening their quality, which is huge. The second one is evaluate what works. The third is fostering, enabling ecosystems. And then how for design for integration. So instead of reinventing the wheel, how can we see where they can fold into what's happening? And so we would love to have your input. We're going to move quite quickly. So if you could go self-appoint yourself to one of these areas, we'll have only 4 minutes. And you can write down on a sticky note or on there. What we hope is we don't keep seeing the same ideas, because each of you come from a different spot in your work, and you will have ideas that maybe no one else will have. So please, when you come to your place, you'll see what the topic is, and let's just see how can we make these models successful from these angles. Okay, thank you so much.
So you, MHAi, you are at Yeah, this is the one.
For our virtual participants, I just put a link to a Canva document in the chat where you can share your thoughts when you see a question, and we'll make sure your thoughts are brought back.
Just this overall, how we I don't have experience with this field, but I
I'm really good at what are some information, but yeah, it's interesting. Diana bought it.
It would have been about like initial relationship, like beginning of any program, like your situation, and then you say what the context is, and like you're asking questions that
Hello, late night crowd. Thank you all so much for tuning in.
going and learning about this together. There has to be like partnership
We're
relationship.
good. If it's just the 3 of us in the room, definitely feel free to tune out. I know I'm really late for you all, but I'll be here in case we have any of the other participants join the breakout.
I say like, listen, I'm pleased to be part of the team, but we're working on this together.
Yes, no problem. Hi, Tara. Thanks for joining online. Okay, I know we had a couple of our virtual participants, and I invited them to join the breakout, but if they don't, that's fine.
I feel like we're I'm the only Because that is so
There was the individual in the chat who identified themselves as being with MHAi, but we had actually 3 others at one point. They were kind of coming in and out, so I'm not sure if we'll get them or not.
That connection between the end user and manufacturer. Like, does these girls like your verification or how does that work?
Yeah, so for the audience, like, so ours is the gold standard.
Oh, I'm doing a quick look.
We're saying if they did that,
I would say about 20. Yeah, mad about that. And we were right after lunch too. Lunch was short.
yeah.
They are people will try out so
yes, I know they're.
I just always wonder about like what's selling between young girls.
Thank you.
Like the features versus material choice.
Of course.
Talk about
Absolutely. You'll have a good night.
I mean, like you shared that example in
You're welcome to if you like, and I can go ahead and end this one. We did have one of the manufacturers that didn't make everything.
I would think about that, like they felt that as well.
Purely in the
Or they like, oh,
economic sense, you
drive
see
sales.
whether you are getting more
Sales will go up.
measure for a common person who is into business. I have experience of being in the social marketing section in the board. We provided environment and then just to create an environment and then wanted to sell them at a subsidized cost. Nobody wanted to. People didn't like that. Even though it is environmentally friendly, people didn't like it. So I don't know how that is. You need to now focus on quality.
I'm thinking about like that.
I can use your time back in.
like and show
And so we already had some sort of
Oh, yeah. And Sandy, of course. Yeah, Eric, yeah. Oh, really? It's funny, very first women deliver. I still have these girls in Vancouver, and I stayed in an Airbnb with everyone, Cindy for Community Sweet Splash. So yeah, so good friends, Stacey Friends Slash.
I worked at
Oh, no way! Oh my God! Absolutely. Our social enterprise side of things. Nice.
Nice, yeah.
I'd love to meet Abiba. Do you want to write a drink?
Okay. Are we moving? Are we supposed to rotate or? We can keep moving. Any other? We can all write it.
I have a question for the manufacturers.
That's so important. That's why I really
Like a young adolescent girl who uses a smaller frame, another do the manufacturers in the end
No, it's, I think they no, I yes, so what they, how they divided it is there's externally warm, externally warm, yeah, that's right. I'm just trying to so ours are no further level,
it's also like how do you collect
but it is my that's just and it's hard
and then so the recommendations for girls is, only use your product for hours. I'm a menstrual specialist, and I decide on a bit different lengths of time depending on my flow. And so for girls, when you will touch on recommendations, it's already to change. 46. You have that,
I don't know that it must have been to our section.
So there's something here that they're not going to change because they don't know. We're trying really hard. Lasha's working on that very diligently.
Alright, it's time to rotate, everyone.
Thank you so much. Really nice to meet you. Tell Sandy that you found me. I was at her house, because I didn't know her. I know. Is your group coming? Yes.
We'll talk about choice, because I feel like so many times that first thing it does change your period and your vagina and whether or not you've had babies and all this preferences and traveling and all this stuff. But I don't know what to here that aspect of how when you did a survey and asked a woman what she wanted, she would probably just say in all cases. It's like that's just no. And so
I had the same reaction.
that window,
trying to convince someone or incentivize someone to try something and then use it as a champion to tell other people about it, like where that sort of fits in.
But they're like, oh, you're and all the women are like, oh, yeah, I tried that.
Yeah, I think that this is the sort of new issue. Oh, it's different. Like, what, yeah? Oh, I think it was like,
In my discussions, it's what happens. So we know what you're saying. Okay. So like, when you think about, like,
I don't know much about it.
so you talked about local government. Are there other actors that would be providing that?
policy is successful?
Yeah, I mean, localizing whatever national regulations or standards are there is really important, like in Kenya, we were working with all those Kenyan districts to localize commercial action and biodiversity standards. Like it's really easy to have a great national plan, but if we're talking about a local market, then it's local on my end.
No, that was actually when I was writing. You're welcome to take
Okay, see ya.
Because they're the ones that are supposedly.
But I like what you said, even just the Nepal example about like longer pads and stuff like that. And I know in Madagascar we had like anti-nest pads. I don't know how that worked, but I was not seeing no, I can show you a picture.
Yeah, I've heard about that.
No, it was like a strap.
Oh, it's a belt. Yeah. It's a belt because but that could come into quality, whereas okay, people are getting back.
Just simply like what they need to make so modify. So they can element the ship doesn't absorb my blood. You know what I mean? That's quality.
Yeah.
So how would I phrase that?
Like customer grievance mechanism or something like that.
Customer
feedback. Yeah, regular customer feedback, regularized here. Yes. Yeah, because then maybe it's like built into the training for the
That should be easier to do.
Go back, I think if you can't do there, first go back, you know, and then 3 months is that
right? Well, and then people aren't buying it.
You also provide. The funny thing
in
when
fact,
it comes to manufactured products, the schools, they may be able to free of cost, but they will go to a health facility afterwards. They are not. That's what I'm saying. We talk about,
That's a big one.
and that's why we did
about demand generation, but when it comes to the product availability, it's not available.
I think on that case, this one, if we want practice, maybe for example, there is a sexual and reproductive health program practice to minister.
Yes.
So can we integrate menstrual hygiene part with the ongoing sexual and reproductive health? So that counseling and anyone going for PNC, because PNC there is a specific counseling. If any clients are menstruating emergency, there is care available. And then also when you are training the healthcare workers, building their competence and capacity, that also is done in system. So kind of making it part of the integral component of sexual and reproductive health, maternal health.
Health system, just like a laboratory, we talk about.
Because those are two. So targeted. But it's not, it's like, to me, it's not
about targeted because people will then assume adolescents or adults. I mean people who have a different physical need for a product that might not be met by the product that I produce.
So it would be, you're talking about physical disabilities, not necessarily.
It could be any kind of disability. It could be intellectual disability, has
So even the indicator in PHMS and MIS.
I'm not neurodivergent, right? So like, but I mean, there's when we, you know, and this gets.
But that requires like one oversight.
It needs to be, we cannot
Get it?
focus on just but we also need to. I mean, it's the same thing as always. That we have a chance to actually you know.
Exactly. If there are, let's say, nationally agreed standards, it has to be legislation or something.
We're just writing physical ones, that's why I asked, whether we're talking only about physical.
It means physical or intellectual, I would say. I mean, or, I mean, actually, disability because you can't see. You don't want to be aiming into your panties because you can't see your panties, you know, maybe you prefer the belts.
So we can show that it is there in specific terms which can be measured, and that encourages that somehow forces them to make sure that it is available, it is addressed as part of their package of information or services.
Do you have like your aging health program?
What?
I mean, look, I think when it comes to mental health,
Yeah, we do site visits, but like, you know, what happens 2 months later when you're
are you going to include?
So that's what I was saying, talking about in terms of health education is fine, but in terms of product availability and making it you should use this or you can even educate. When you go somewhere and the products are available, they will be forced to choose whatever they can get there.
So they deliver, do they give the delivery kits? Part of the initiative program?
But it's true.
You're talking about
Delivery kits for part of the initiative.
No,
Part of
but
the
they sales, you mentioned sales.
there is no longer provision of
Yes,
kits.
but the question is, do we need
All
to
services are provided free of charge. The government reimburses
Check the quality from you, that
somehow we
means,
need to find ways to
that's what I would question.
otherwise.
No,
Very start,
I agree.
I mean, at least we're.
It has to be standard. It has to be integral to that free healthcare service. Free healthcare service should recognize the importance of this component and add it, whether this is promotion or supply chain or
And so
I mean,
there's some.
integration doesn't mean institutionalizing through the government system. So let's make sure that anything happening in part of the assessment MHAi is integral.
Because like when,
This is a missing link here.
In our context, if I may say again, like we have a minimum services standard package where you measure overall service quality of health facility, a basic health portion or a specialized basket. But I am not sure that it is mentioned in this. Nobody talked about it as part of the.
Well, I mean, I do agree. There is a lot about the, I mean, the private sector or the market leading the way to accept feedback. There's a market and investing in the standards and the oversight of the standards isn't going to be their priority. So for those who are manufacturing products, I mean, at high standards. It, you know, if you have to wait.
We're done.
Do you know why they report
Oh,
But she's 17 months, so you know, like, I think she's something like this. And she's also, I think, in King. King out. And she's like,
Oh, so can, okay, everyone, thank you so much for taking time to share some of your ideas. What we want to do is, we thought it would be great if we could hear from everyone who led a group, if you could just share one or two of ideas that came out that you felt would be good for everybody, if you saw a theme as you went through. So I'll go last. Let's start with group number 2, 3, 4, and then I'll finish with quality. So, but come to the microphone so that people online can hear us. If you don't mind.
Okay, so just stand here so I remember what we discussed, but we had really good discussions. I think a lot of, so we focused on evaluate what works, so around monitoring. We focused a lot on like the business side of things, like also user feedback. Why do people decide to, procure certain products? But also, is the business effective? Are the sales numbers at the right level? But then we also spoke about, maybe there's some other things we could also monitor, and that was around the social return of investments. So like we looked at the other outcomes that these decentralized models may have around education, breaking taboos, local ownership. So how do we actually monitor all of that? And I think that was very interesting because it goes beyond the regular monitoring, is our business model successful, yes or no? And the whole point of these decentralized models is that, it's not just about the business, it's about everything else that is important for menstrual health as well. And then I think also making sure that we are monitoring the quality of products and alignment to national standards, ISO, etc. is another thing that came up. I'll stop here, and group 3.
Yeah, while you pass that, I just wanted to add one point that it's hard to measure, but one of the things that we've seen from our decentralized access models, the local leaders, is they said now we can speak up in meetings. Like before, they didn't feel they had a role to play in community meetings, but now that they have a business, they have become very vocal and active, and that's something that's hard to measure, that then they're helping advance menstrual health in their communities that way. And we just really quick, we had a question right here. Yeah, come here just so people online can hear us.
Sorry, Mariah, as you were talking about monitoring, I couldn't help but think about the priority indicators that we have for girls. And then I started thinking about how a lot of the conversations that we've been having around these indicators is how to get greater uptake of the indicators. And I was thinking that percentage of girls who reported having enough menstrual materials during their last menstrual period is on this list and could also be an indicator for whether or not there is enough decentralized pad production. Sorry, what's the exact decentralized access model? I'm just thinking about how to link it all. So another little plug for the indicators.
And actually, can we put a plug? I think you're doing a session.
We are.
Tomorrow. What time? 8:30 here.
This is like the period room.
Okay, so come learn more about these. Yes, thank you for bringing that in. Okay, thank you. Okay, Elise.
Yeah, I think a lot of discussion on not reinventing the wheel, which is important. For fostering enabling ecosystems, we talked about a bunch of different things, but I'll highlight discussion of supply chain, and especially supply chain across the full value chains. We're not even just talking about access to products and use of products, but also disposal. We talked a lot about getting the right stakeholders and also thinking about getting concrete actions from those stakeholders. So finding ways for local government or NGOs or others to provide capital to those women's groups, thinking about local production.
as well as making sure that we are engaging with schools and health facilities came up a lot. So there's a couple I'll highlight. Okay, thank you.
So we discussed that we need to have the government accountable first. So for that, we need to institutionalize it within the government system. Like for example, in Nepal we have a federal system. So local government, they have this local planning. So maybe, you know, the planning and budgeting of the local government, that can be integrated. We also spoke about how it can be integrated within the Washington school standards. And probably public-private partnership. And yes, and also about the indicators in HMIS and EMIS, like health and education. We also have NWASH in Nepal, which is for the water. So integrating through the monitoring through the data as well. Yeah, so these are some of the highlights from the school.
I can't underestimate the power of data, right, to tell the story. And then mine was on quality, and I really like someone had said that really if you're going to be getting feedback on quality, have equal playing field. Like not someone's coming in like the expert, you know how that goes. So I just really like that idea. And then does the quality match what the end user's idea is? Like we're thinking this is quality, but is it what they really want? And along that line, getting feedback from the consumers, you know, from all of them, like build that in, the different ages, and don't forget people who have disabilities. Like, are we meeting all of their needs and not just assuming that it's a one size fits all, because we know everybody has different needs at different times, we use different products. And then I really like, we were talking about quality, and where is she? I don't see her. She talked about using AI. And she goes, you know, there could be a time, she was talking about how with crops right now, I think she left the room, and she's talking about you could put in, so I don't know all the new terminology, but you put those things on, and you can walk, what is it?
VR.
Yeah, VR. And so she said that right now they're testing crops. They're putting these on and the people are walking through the crops. And so people, agriculture specialists, are getting feedback. And she's like, why couldn't we get to the point where we check that quality that way? Anyway, I thought that was a great idea. We got to think out of the box, right? AI is here to help us. Okay, and then another one was just know your standards, or know what policies are in place by the governments, so that they can actually support and know at the local level they can be driving, because that's part of their mandate from their policy. So thank you so much. And then any other thoughts on that? If not, we just have one other little thing. What's the time check?
Plenty of time.
Yeah. Okay. Good. Okay. Well then, we still, now we're just going to do a little bit of group work. We started this discussion off with those questions, finding out, do you want to leave this part?
I don't know what you're about to say.
Okay, sorry.
Well, in the video reflection, we could just skip it.
Okay, oh yeah, okay, yeah.
We'll just hold an interest.
Okay, so I'm going to turn the time over to Jess.
Okay. Sorry. All right, let's bring this thing full circle, shall we? Woohoo! Whoop, maybe. Okay, we're coming back to Menti. Maybe you still have it on your device. The code has not changed. It's the same one, or you can scan again. Give us a second here. Look at that. Remember our word cloud from the beginning? Okay. Same code. Folks are scanning. Give it a second. Take a breather. Drink some water. Long day. Stay hydrated. Okay, and I think everyone's scanned now. All right. Let's start with some open-ended takeaways. What is one new thing you learned from today's session? It doesn't have to be about decentralized access models. It could be anything new you learned from today. The ISO. New terminologies. AI for quality. All right, give it maybe 10 more seconds, so finish up your last thoughts here. Okay, great takeaways. Lots of conversation about standardization as it relates to quality and how it can support decentralized models and keeping up that quality even when they're operating in different environments or different countries. Foreign currency loss and the other things organizations as aggregators can do to support their decentralized access models. What a decentralized access model is, that's great. One of our goals was for people to leave with that takeaway, so we're happy about that. And people with different needs, meeting the communities where they are and how decentralized access models can help us do that by really tailoring a solution to the community that they're in. All right. This question should look familiar. Do you feel decentralized access models can be successful?
Like the best pre and post test.
I know. Just give it a few more seconds. Okay. I'm happy that people feel they learned what the term is, so that's great from our first set of results. But I do think it's interesting, maybe depending on what context you're coming from, maybe this seems like it would really, really work in your context, or maybe from the conversations we had around the room, there are things that might be challenging that would need to happen before a decentralized access model could be successful. And I think one of the key points from the research for Menstrual Health Action for Impact is that there are challenges with this model. It is not one size fits all. There are other things to take into account beyond just having someone on the ground capable of doing the work, but also that they're in an ecosystem that's able to support it. Last question. Is there anything that you learned today that you could apply to your own work, whether you work in menstrual health, or in WASH in some other form, or in policy, or in research? Any last little takeaways? Something you'll bring back to your supervisor when you write your report on why it was worth sending you to this conference. What would you say you learned in this session? So the standardization thing seems to have resonated pretty well with this group, so that's great. Menti, I agree completely. All right, does anyone want to expound upon anything they shared here? We have just a couple minutes, and I mean, we're all here together in a room in person. How often does that happen in the menstrual health space? We have a microphone and we have time.
Oh, wow. Do I have to get on the microphone?
Just for the recording also, both for folks online and for folks watching us next week or next month or next year.
This is Kelly from CARE. Thank you so much for this session. And I just wanted to say, I don't really have a question, just a comment, that I think it's awesome to come into this space and have choice be the first thing that I really heard people talking about. I think that's awesome, because obviously it hasn't always been the narrative in this space. So the choice for menstruators to choose what they want when they, different times in their life, and then having awareness of what is actually out there and available for them. Thank you.
Thank you. Awesome. Thank you so much. Other takeaways, thoughts, questions, comments, concerns, complaints?
Since my name's up there, I'm just going to explain what that is. A number of years ago, when Grand Challenges Canada was funding a lot of the social enterprises around menstrual products and menstrual health information, they asked myself and Penny Phillips Howard and our little teams to come up with a theory of change and an M&E framework so that they could better evaluate the scale up of these initial organizational efforts and then the impact. So I sent MHAi the article. We wrote up an article about it. I mean, Grand Challenges has the original. Then they used the framework to assess their grantees for a number of years. I wasn't involved in that. So that article, which is open access, anybody can see it, has the theory of change, but it was really about these sort of initial, I don't know if it fits what you all are talking about, but it was really taking these initial efforts that we're trying to go to scale. I was just scrolling through it when I was sitting here, honestly, to remember we put in there, it's been some time. And then it does have indicators, it does have, so it really is, but I would imagine it would need to be adapted a little, but just you're not reading that, starting from scratch, it might be helpful. But again, anybody, I sent it to Mariah, so she can just forward it along.
Thank you so much. Any other thoughts? Okay. Well, thank you everyone for taking an hour and a half out of your conference to join us. If menstrual health is not normally part of your workplace agenda, we especially appreciate you taking the time to come and learn. I think the plenary especially really set the foundation for relying on local leaders and what that might need to look like in this work going forward. This is not the only way to engage local leaders, but it is a way to consider. And again, we have this fantastic research from Menstrual Health Action for Impact. They were able to share with us to kind of have some takeaways as we look into what decentralized access models could look like in the future. I know the presenters will be around for a couple minutes if you have specific questions about any of the case studies or the research from MHAi. Thank you to our online participants or anyone watching next week or next month or next year. We're still happy that you're here. And again, thank you all. Have a great rest of the conference.
Before people leave, I have a PSA, public service announcement. Sorry, I forgot to ask you. I'm just taking over. I'm going to step on my soapbox, and since we're all MH, passionates here in the room, I hope so, especially after the session, I want to invite you all for an informal get-together where we want to brainstorm with you to build a shared agenda for action for menstrual health. So we have a flyer here. I only have a few copies left, so you can take a photo. Tomorrow, across the hallway in Bellflower, we're gonna occupy the room. It is not official. If we're being kicked out or sent away, we have to find a different location. But we do hope we can get to stay in the room tomorrow, 4:30. Come, we'll talk about political economy analysis for menstrual health at a global level. We'll talk about the shared agenda for action, kind of a call to action for menstrual health, and we all want you to be part of the conversation. So thank you so much.
Yeah.